I have the pleasure of introducing Ikenna, who has the Align SCD Emergency Department Project, and he was born and raised in Nigeria until he was 15 years old and attends UC Santa Cruz.
Okay, thank you very much for that for the introduction. I had the pleasure of working with the Align study this summer alongside Dr. Marsha Treadwell, who is a hematologist at UCSF Children's Hospital. A little background on sickle cell disease is that it's an inherited red blood cell disorder affecting about 100,000 in the United States and predominantly African Americans. Individuals with sickle cell disease often experience acute painful events, also known as vaso-occlusive episodes, and usually they can treat this at home. However, when it gets too severe, they have to go to an emergency department. Now, research and study has shown that individuals have expressed dissatisfaction with their easy ED visits due to negative experiences, including long wait times and stigmatization as drug seekers. Now, this stigma is derived as opioids are usually used to relieve pain in individuals. Now, this results in poor pain management and lower overall quality of care. So the objective of this study is to increase patient satisfaction by examining factors associated with the effectiveness of individualized pain plans in the ED department for adults within the ages of 18 and 45. And this will be measured by patient satisfaction and quality of care. Now, this is how the study works. So we have a sickle cell disease specialist who creates the individualized pain plans, which includes the patient's name and contact information, as well as genotype, recommended pain treatment, and treatment dosages. Now, when the patient goes into the ED visit, the ED provider is able to use the IPP to treat the patient and be able to see the correct amount of treatment and dosage that they need. For this study, for patients in this study would at least have had one visit to one of the sites in the past 90 days and one clinical visit within the past 12 months. After each visit, within a span of 96 hours, they will receive a survey via text, and the survey will ask questions that address the visit satisfaction and care received, as well as extent of which the pain was actually treated and the time they spent in the ED department. Now, responses to the survey will be scored on a 5-point scale, 1 not at all, and 5 very much. And these responses will be averaged to determine patient perceived quality of their ED pain treatment. Similar studies have been carried out that shows the effectiveness of the use of IPP in improving patient satisfaction in the pediatrics department. We expect to have similar results to this, as the IPP should prove to be effective in increasing patient satisfaction and perceived quality of care and overall pain management. Now, this is really significant as the results of this study is going to provide evidence regarding factors that influence patient satisfaction with the implementation of IPPs and the impact of IPP on actual pain management. Thank you.
Fantastic. Well described, nicely done. Okay, so questions for Ikenna?
I had a question. Is there a particular group in which you're going to be giving all this data to, or is it hospital by hospital or provider by provider?
Yeah, that's a good question. So there's going to be multiple sites in which we're going to derive the data from. And based on what we get from this site, we're going to analyze it to see the effectiveness of the IPP plan.
Hi, I'm not too familiar with emergency room protocol, but what situations would normally prompt sickle cell patients to visit the emergency room, and how are they not a triage of higher importance?
Right. So usually when they have these pains, they can usually treat it at home. However, like the pain could get really severe, and at that point they have to go to the emergency department to seek care and treatment. And sometimes, like I mentioned earlier on, there's a stigma of the use of opioids, because opioids could also be used to address pain. And so sometimes patients don't really know how to necessarily express their pain and don't really know what to say and how to show what areas they're feeling the pain in. And so due to this, they receive less proper treatment.
I had a question about like just how the IPPs are like presented. Has there been like an app designed to show IPPs, or is it like in their health record?
Yeah, it's kind of an app, but not necessarily an app, because you're supposed to access it on your phone. Your health records is gonna be in the IPP plan, but it's not solely your health records. It also includes different things in there. And so I guess to answer your question, I would say that it's like an implementation of that as well. So you can go online and look up your own personal records, and this will have your treatment dosages and your treatment plans that you already have.